Hello, my name is Larry Chapman, and I welcome you to the Why Take Level 2 Certified Wellness Program Manager presentation offered by the WellCert program through the Chapman Institute. Our agenda for this session includes the following topics. First of all, we're going to look at an overview of the WellCert program itself. Then we'll look at the 4 areas of emphasis that we attempt to address in the Level 2 course. Then we're going to look at some actual slides from the Level 2 course as well. Then we'll look at some of the case characteristics associated with the case organization for this particular level. And then I'd like to share with you some of the tools that are available in the Level 2 course and have been integrated into the coursework itself. And I also want to cover with you some of the venues that are available for you to take this course, as well as its cost. And finally, we'll identify how to get any of your questions answered about this course and about its applicability or appropriateness for you. Let's begin first with the overview of the WellCert program. And Level 1, the Certified Wellness Program Coordinator level, provides an emphasis on the design skills and a grounding in some of the basic constructs and conceptual frameworks that are useful in our field. Level 2 emphasizes, building on Level 1's content, the operational skills that are appropriate to how we manage and how we carry out the operational level of management in our wellness programs. Level 3 provides an emphasis on larger organizations with a stronger focus on the AMSO principles and concepts, and also maximizing health and productivity management effects of employee wellness programs. Level 4 emphasizes the development of consultation skills and the ability to look in a more strategic fashion at the health management issues affecting an employee workforce. So these are the overview of some of the major issues and areas of emphasis in the 4 levels of certification. Now let's look at the emphasis on Level 2 and why we believe this particular level is important for you. And first of all, it is to enhance engagement. And so one of our primary operational level challenges is to do that. And we do that through focusing on 3 basic skills. First of all, how to maximize participation. We cover 6 major reasons why people don't participate, and then we talk about 12 strategies that are linked to those that you can use to increase participation and engagement. Secondly, we go deeper into incentives. So we look at best practices, kind of the ideal approaches to incentives, and how to maximize what's called motive force, which is the power of the incentive to actually bring about a qualifying behavior. And we also talk about how to build employee trust. So that's another one of the 3 areas that are really to deal with the challenge of enhancing engagement levels in our populations. The second major challenge is what we call growing your influence. And that comes through your ability to gain stakeholder support, and that's both key internal and external stakeholders. It deals with also how to use ROI and VOI analytics, so return on investment and value on investment analytics. We look at 3 different areas, both leading and lagging indicators, and how to grow your wellness budget. And that includes our ability to use budget wisdom and some tips about formulation and positioning, but also how you can use stretchers to expand your program at lower cost. The third major challenge we look at is how to be more innovative in our approach to managing the operations of a wellness program. And there we look at how to build in well-being without losing the valuable base of wellness that we've grown over the last 4 decades, and how to use self-service technology. So we look at 5 different kinds of common self-service technology, including e-health portals, trackers, commitment devices, online behavioral management programming, and our ability to use smartphone apps. And we also look at how to manage vendor relationships, the selection process, as well as the management, as well as the use of vendor report cards. We then move on to the challenge of securing results for our programming. And there we focus deeper on how to assure results through use of the AMSO construct and how to maximize our return on investment. There are 10 basic overarching strategies for doing that. And then also how to leverage the most we can get out of biometric screening and coaching to be able to bring about long-term behavior change, and particularly moving from short-term behavior change to long-term behavior change. So these are the areas of greatest challenge that we address in the operational-oriented Level 2 course. Now let's cover some highlights from the Level 2 slide deck and share with you what you can do with some of those individual kinds of insights and information and content that come with the course. First of all, this is our results hierarchy, and this is important because it allows us to identify the higher order results, which are dependent on us achieving the lower order results. So you can see from the beginning down at the bottom, attention changes, knowledge changes, attitude, readiness to change, changes in the population, and then those oftentimes leading to our short-term behavior change. In most wellness programs that I've had experience with over the years or seen, there's usually a chasm between the short-term wellness behaviors and the long-term wellness behaviors. And we essentially need to cross that chasm in order to get to the higher order results, which include health risk mitigation, health status changes, disease prevalence and condition prevalence, healthcare utilization changes in the population, health claims cost, and eventually economic return. Here again, we're focused on health plan cost, sick leave absenteeism, workers' compensation costs, disability insurance costs, and presenteeism costs. This next graphic or visual comes out of the incentive area, and it's really the types of incentive pay values. And we essentially talk with you about the primary rewards, which you can see them listed, as well as the secondary rewards, the other types of rewards we oftentimes use in terms of incentive programming. Again, the incentives are intended to reach into that 80% of the relatively not intrinsically motivated people within a workforce around wellness, and to actually bring them to the table, help them get on the wellness bus. And the effectiveness in terms of motive force of these, we discuss in more depth, that has to do with how to combine and connect several of these into more powerful forms of incentives. So that's one of the areas that we cover in terms of the incentive issue that's linked back to our engagement strategy. This next example of a slide is an example of a vendor report card. And here we talk about how to give useful feedback to vendors. And we also provide you a tool that is in the back of the book that allows you to use that as a format and a worksheet to actually give feedback to your vendors. So that's a portion of that staying innovative and helping guide the vendors to do the best that they can for us. This next graphic slide example is the results-driven wellness reporting framework, and we build on that by actually talking about the analytics, and there are about 32 metrics that we cover in this particular section. They deal with the issue of productivity metrics, which have leading indicators and lagging indicators, and there are a number in each. The cost metrics, which allow us to do the return on investment. The productivity metrics, by the way, are shaped and oriented to VOI. So it's the VOI application to our analytics in our wellness programs. And the cost metrics, again, are leading and lagging indicators, and our program operations metrics, again, are leading and lagging. And the idea here is the business context of what are the indicators that show a fairly immediate response and those that lag behind that immediate response. So it helps you to get a better handle on using analytics in managing the operations of your wellness program. The case characteristics for this particular level, level 2, includes a light manufacturing, it's metal fabrication, light manufacturing company. It's called Talcott Manufacturing, Inc. It's based in suburban or rural California. About 5,000 employees, 4 major locations, about 150 remote staff. There is a unionizing effort underway, so we have to be a little careful about how we approach wellness. Lean financials, 4 health plans, 78% male, lots of survey data that help us refine our design. So that's the case characteristics for TMI for the level 2 course. The level 2 toolkit contents include the following. First of all, we provide you in Tool 2-1 with an AMSO assessment worksheet. There are 10 questions that help you get a sense of how well you're going to cross the chasm between short-term and long-term behavior using the AMSO construct. Tool number 2-2 is the WellCert Master FAQ list, so it allows you an opportunity to enrich your own FAQ with issues that have come up or come up frequently in virtually all wellness programs on the part of employees. Tool 2-3 is a sample of a vendor report card. Mentioned that earlier in this presentation. Tool 2-4, strategies for improving employee participation in your wellness program. That's a deeper dive into those 12 basic core strategies for increasing participation. Tool 2-5 is an ideal wellness incentive program. So we basically lay out for you what we would consider an ideal approach to a wellness incentive. Tool 2-6 are tips for using self-service technology in wellness programs. And that again covers those 5 different types of self-service technology. Tool 2-7 is a listing of the biometric measures for wellness programs from the most authoritative or normative source in terms of those biometric measures. And Tool 2-8 is a sample of a wellness program budget for a 300 employee company. Tool 2-9 is a summary table of recommended wellness metrics. That's where our 32 metrics are lodged, also along with their uses and their derivation, how we come up with those metrics. Tool 2-10 is how to calculate a wellness program's return on investment. We do a deep dive on a non-claims based method called risk conversion and a secondary method based on claims data called a growth rate analysis. So we give you some in-depth exposure to the calculation of return on investment. Tool 2-11 includes a specific strategies for optimizing your program's return, results, and return. And here we go deeper into those 10 core strategies. Tool 2-12 is essentially an instrument that you can use for assessing organizational readiness for wellness and well-being programming. So it helps to get a sense of where your organization is in terms of how it approaches wellness and well-being. And finally, Tool 2-13, what to look for when you do a wellness walkthrough. So it's a way of kind of checking off how wellness oriented a particular worksite setting is. So in summary, these are the level 2 toolkit contents. The venues that are available for you to take the level 2 course are, first of all, live webinar, and that Certified Wellness Program Manager webinar will take place starting on July 11th. It'll go for 4 weeks, the same day of the week, and it covers the time period Eastern Seaboard time or Eastern time of 11 a.m. to 2 p.m. Eastern, and Pacific time would be 8 to 11. So that's the live webinar. It's on our website. You can essentially sign up for that, register for that anytime. It's currently on the site. That's 3 hours a day, July 11th, 18th, 25th, and August 1st. The second venue that you have for taking the Certified Wellness Program Manager course, the Level 2 course, is you can start at any time, and it's a self-paced course. It has all the material that you could use in the process itself. So it's self-contained, and you can access it as fast or as slow as you want. You can also, by the way, we put the online course into your live webinar when you register for the live webinar, or when you take the in-person training on level 2. So in those other two types of activities, we give you the online program so that you can access it later and or look at anything that you want in a deeper fashion. In addition, the in-person, these have not been scheduled. That's why they're in a different color. And the Certified Wellness Program Manager course will be given in one or more of these locations in 2018. And if you have a preferred location, please let me know and let us know, and we'll be glad to let you know about when that is scheduled. And the cost for that is $899. We generally provide an opportunity for you to have a discount of $100, so it kind of brings the cost down to $799. If you are paying for this out of your own pocket, not your employer, and or you work at a nonprofit or a public sector organization, we actually have a $200 off discount. So that brings the cost down to $699. So again, the blue items are already on the website. You can sign up for them anytime. Just follow the prompts into the area that you need to. And then the in-person will be letting everyone know about the availability of the Certified Wellness Program Manager Level 2 course that will be given in several locations around the country in 2018. Now, in terms of your questions, if you have any questions about the Certified Wellness Program Manager training program, please email our customer support at support@chapmaninstitute.com or give us a call at that number, 206-552-9399. In addition, you can also visit our website and provide any kind of comment in the comment box, and that will also enable us to, or myself or my staff, to get back with you. So I just wanted to thank you for watching today, and we've tried to give you a thumbnail of why take Level 2, the Certified Wellness Program Manager certification program.